Happy Friday, everybody. This is A Cup of Tea with Dr. Lee. So, my name is Michelle Lee. I'm a doctor of acupuncture and oriental medicine. There are less than 15% of acupuncturists that actually hold a doctoral degree in our medicine. With that being said, I've come into a lot of questions, a lot of concerns regarding acupuncture in general, what it does, how it comes about, and really just a lot of random questions that I think I would have as well if I wasn't familiar with this industry myself. So a little background on myself. My name is Michelle Lee. I have been practicing for quite a bit now. I'm a fourth generation acupuncturist, which means, yes, it's been in the family for quite a while. I have a rich family history with this medicine, so it is near and dear to my heart. It's very personal. I myself had an interesting case. Aside from being passed down in the family, when I was a freshman in high school, my close friends still know about this incident. I'm from Atlanta, so there is a highway congested area called Spaghetti Junction with 285 and 85, and it is very dangerous. I was on the way to a cello recital. I know, surprise, surprise. Me being Asian, I played both piano and the cello for a very long time. But on the way there, it was the first day of spring break of my freshman year, so back in 2000. We were in a 1996 Toyota Corolla. It was a little red car. We were getting onto the highway and an 18-wheeler hit us from behind and dragged us a couple of exits. Our car was completely destroyed, and total miracle that my mom, who was driving, both my brothers were fine, but I had been thrown around the car so much that they had to use the jaw of life to open the doors and pull me out. And I don't know if you guys have seen Kill Bill, but there is a scene in there when Uma Thurman is pretty much yelling at her toes and commanding them, move, wiggle, wiggle, right? Well, the police officers and the paramedics that were there were very, very scared to be loud because they realized that I was paralyzed. So they were very calm, they were very professional. They moved me onto a stretcher and they put me in a brace, and I think it was the most terrifying couple of minutes, and it felt like an eternity. I was rushed to the hospital, and the doctors told my parents that I should be prepared to be in a wheelchair. Mind you, this is my first day of spring break of being in high school. It was honestly the most heart-wrenching thing to hear as a freshman, and I was terrified. I spent a couple days in the hospital. I had pastors and friends and family, everybody coming to visit and pretty much see really how I was doing. And I decided, hey, I'm going to be a rebel. I really had to pee. So I threw my legs, literally grabbed them and threw them over the side of the hospital bed, and I just collapsed. I fell on the floor and I couldn't get up because I didn't realize how heavy I was. And I'm 5'2". So you can imagine I'm little. And I gave up. Couldn't do anything, and I felt like that was the end of my life. My dad and my mom, both acupuncturists, decided, you know what, this isn't right. They signed about 30 pages of consent forms and pretty much signed away any rights to come back and tell the hospital that they were wrong. They took me home and they did many, many hours of acupuncture. Traditional needles, electrostimulation acupuncture, cupping, moxibustion, just everything under the sun for acupuncture. And about 8 hours later, it felt like every nerve ending in my body was being blowtorched from point blank range. I was sweating, I was screaming, I was crying for mercy, and I was begging to stop because I just couldn't handle the pain. I'd pass in and out, but I could feel my toes. And as you can see, I'm shaking because it was one of the most painful times of my life, still to this day. And I was able to wiggle my toes. My parents brought me back to the hospital. The doctor took a look and said, there's no way that this is possible. Immediately put me through a whole bunch of tests, immediately had me go into physical therapy and try to do some rehab. I am able to run. I'm able to do every activity, and I do MMA as a hobby. It's mixed martial arts. And it's just as a benchmark to show you that I am fully recovered. But my pelvis is still misaligned. It's still, one side is a drop pelvis, so there's a little bit of a discrepancy. So I can't do a lot of things for long periods of time without having back pain. But I am functioning normally. I did not miss a single day of that school year. I went back to school that following Monday when spring break was over, and only my close friends knew what had happened in that terrifying week. Why the long story? It's to tell you that I truly believe what we are doing, we as in all acupuncturists around the world, whether you practice traditional Chinese, traditional Korean, Japanese, Ayurveda, whatever it is that's out there, I truly believe there is something to be said for this medicine. It's not alternative or complementary. It's Eastern medicine. And I'm living proof of it. You can check my hospital records. You can talk to the doctor, who is still, to this day, a very, very good family friend of ours because he's now a believer. So do I believe acupuncture is a life-changing experience? Absolutely. Do I think that acupuncture is better than Western medicine or anything else? No, absolutely not. We are in Eastern medicine, different part of the spectrum of the same medicine. Now, medicine had to come from somewhere, right? You have the chicken or the egg, but in this case, it's, do you take the Western route or the Eastern route? You can get to the same place, but there are so many different routes. Now, as a side note, my personal belief is everybody is meant to find the practitioner that they are meant to find. Meaning, you can get lucky, see this video and say, hey, maybe I should try acupuncture, and you call the guy up that you know, or somebody knows in the town that you're in. You have a bad experience, or you have a good experience. Now, this goes into the frequently asked questions of acupuncture. I have a lot of people that come to me saying, this is like a Hail Mary, a last resort. I've tried everything and nothing's working, so why the hell not? Well, everybody has gone to a doctor once in their life and said, nope, this is not for me. Doesn't mean you stop going to see doctors, period. It's just that person wasn't right for you. The way that we talk about it here in Eastern medicine is your energy and my energy is not compatible. So why is it important to find the right practitioner? Just like you have to get a second opinion or third opinion from your Western doctors and providers, it is the same thing with acupuncture. Not all acupuncturists are the same. We practice different techniques. We have different frequencies. So, for example, if you are with a group of friends, now let's, just for the sake of being funny, call them chi suckers. Chi is life force, it's energy. So it's a very basic component of acupuncture. It is what makes us move. It's what makes us be alive. So in a group of friends, there are people that you spend a little bit of time with and you feel great. You're just like, wow, I can go conquer the world. you're positive, you're feeling good, you're not tired. Those people have compatible chi, compatible energy with you. On the flip side, there's somebody you just love to death, but you spend a day, just a conversation, having coffee or tea, and you're like, oh my God, I am so tired. It's not the bad person. It's not that the person is horrible. It's just that person has either stronger or conflicting chi with you. And there are ways to combat this. I mean, we have Qigong, we have Tai Chi, we have breathing exercises, meditation, whatever it is, you name it, that you can do to protect yourself and your chi from being chi-sucked. Now, that is the same with practitioners. Most of my colleagues, and I meet a lot, we practice Tai Chi or Qigong, breathing exercises or meditation, and then a lot of people are going to say that's a load of crap, but we do whatever we can to make sure that we are at 200% all the time. Because the difference between somebody being at 200% and being able to give and move chi in the patients versus being at 100 and only having enough for themselves is a world of difference. That's why acupuncture is different than Western meds. We spend a lot more time with you. It's a lot more personal. It's a lot more intimate. It is truly a journey between your practitioner and the client. And I say client because nobody wants to believe, and I don't like to label people as patients. You're a client because you choose to walk this journey with me. You choose your practitioner and they choose you. It is a joint partnership because, hell, I would not trust somebody to stab me with needles because they say they know what they're doing. You just you trust them. And the more you share about your life, the more you share about what's going on, we see a clearer picture, we see a bigger picture. And that's why we are called a holistic, because we see you as a whole being. Not just bits and pieces of you, but a whole being. Your current emotional status, your employment status, what you do for a job will determine what muscle groups you are using, as well as what functions and what emotional state you are going to be in. That's why we ask a lot of questions. And the more personal you get, the more comfortable you get with your practitioner, you notice leaps and bounds in treatments, because now we're not treating just your symptom or what's going on there. We are truly treating the entire body, the entire person, mind and body. Now, unless you've experienced acupuncture, good or bad, right? And I say that because if you've had a bad experience, it's still working. Acupuncture still works. You just didn't find the person that worked for you. So, do I truly believe that acupuncture is a life-changing experience? Again, absolutely. Now, this whole thing, the whole cup of tea with Dr. Lee, it's a very cliche, frou-frou name, for a time that we can sit down and at your own leisure, truly be able to ask questions and get the right answers. Now, do I have all of them? No. I do a lot of research. I do a lot of discussion with my peers because there are some incredible minds out there. I have a specific technique. I have a specific treatment protocol and way that I do things that work for the clients that come through my door and lie on my table. But that's not to say it's going to work for everybody out there. It's the same for every practitioner. Just find the person that truly resonates with you, and you'll be amazed at the difference. Just even walking into a building and feeling, wow, I'm comfortable. That's what you want to look for. That's the type of practitioner you want to look for. But also find somebody that has enough knowledge and experience to be able to back up that good energy. All right, so I have a bunch of papers I printed out, a lot of my own notes scribbled on them, and these are frequently asked questions about acupuncture. So bear with me as I look down on my paper to read the questions and also to give you little anecdotes about what I've been through or what I've experienced, as well as true answers. Okay? All right. So the first question that most acupuncturists will get, and a lot of people that have never experienced acupuncture will have, is, hey doc, can acupuncture really help me? Yes. But there's also investment that's required on your part. I can help you, and I, as in any acupuncturist, can help you with a myriad of disorders, diseases, illnesses, and pains, right? Low back pain, shoulder pain, acid reflux, stress, XYZ, and we can keep going down the list. But if you come in with your guard up, and you come in not to get better, but truly, I just want to test this person, and let's just see if this is a load of crap, you're wasting your time, your energy, and your resources. Go in with an open mind. The least helpful thing you can do is to go in automatically assuming that this isn't going to be a waste of time. Then why do it? Go somewhere. And I say give it 2 to 3 sessions, because with the first one, your body has to process what's going on. Second and third session is when you truly start to build a momentum, and you'll see a difference. Which is another question. It's, how many sessions do I need? Well, what I tell my clients is, how long have you had this problem? For example, they say 6 months. Then isn't it only fair to give me 6 months to help you go back to where you were? I wish I could snap my fingers, throw some needles in, and you'd be better immediately, fixed and done after 1 session. I would love nothing more than that. But it's not the case. So after you see a practitioner, they get a better idea of what's going on. And it could be a acute problem where, hey, you were lifting some boxes and you tweaked a muscle, and we find a whole bunch of other stuff that's been going on. Or it can be something that's been manifesting for a very long time, and now it's just your body is crashing and can't take anymore, so now it's giving you health signs. So that depends on the practitioner that you see. I have a list of about 100 things that the World Health Organization, the WHO, recommends for acupuncture. Sinusitis, rhinitis, common cold, tonsillitis, asthma, toothache, gingivitis, sciatica is a big one, low back pain, hiccups, constipation, diarrhea, facial paralysis, trigeminal neuralgia, Bell's palsy, essentially where half of your face is paralyzed, Meniere's syndrome, paralysis, just so many things on this list. So what training is required? What makes us confident and be able to say we are licensed acupuncturists? And you'd be surprised how many people are not sure what we go through. It's not a weekend course. It is a master's program where it is 3 to 4 years of education, clinic hours, just to pass your education criteria. Once you graduate from an accredited school, you are given the opportunity to sit for the national boards. National board exams, and this varies from coast to coast. Here in the East Coast, the NCC-AOM, the National Accreditation Board, administers 3 to 4 tests depending on what certification you'd like to get. And once you pass that, here in the state of Georgia, you have to have your board exams, national board exams, to even be able to apply to be an acupuncturist in Georgia. Now, as I mentioned in the beginning, about 15% of acupuncturists go on to do more studies and receive their doctoral in acupuncture and oriental medicine, which I've done. I've done my doctoral program with Pacific College of Oriental Medicine, and my focus, my specialty is actually sports medicine acupuncture and dermatology acupuncture. And we'll get into that a little bit later as to how those two actually correlate. But as you see on Instagram and on Facebook and all those other social media outlets, you notice that a lot more football players, a lot more national athletes are turning to acupuncture. Back in the Olympics, Michael Phelps with the cupping marks. It is a viable resource for athletes, but you don't have to be just an athlete to need acupuncture. Daily movements. We have, most of my neighbors are actually training for a marathon or a half marathon for the fall. And I see most of them because I want to make sure that their muscles are loose enough and strong enough and conditioned enough to be able to take all that they are going to be throwing at it. So yes, we require extensive amounts of training, both in the classroom and in a clinical setting. And we pass a series of exams to be able to work with patients and clients with acupuncture. So what exactly is acupuncture? And I've gotten so many different answers, and the one that I dislike the most, and let me read it for you, says, the insertion of needles produces natural chemicals in the body called endorphins, which help decrease your perception of pain. The overall goal of acupuncture is to reduce pain while increasing blood flow and stimulating muscles and nerves throughout the body. Sounds nice, right? But that's not true. Acupuncture is so much more than suppressing pain receptors and pain symptoms. It is truly fixing the root of the problem. Meaning, we can help blood flow. We can help promote better energy flow. Not just pain. You're creating this perception that acupuncture only works with pain management, and that is not true. How many of you actually have personal experience or know somebody in your life that has gotten acupuncture in conjunction with fertility treatments like IVF or IUIs? Exactly. That's not pain. That's truly something more than just pain suppression and management. So then what is acupuncture? We use very tiny needles to stimulate certain parts of the body. Now, there are over 400 points all over the body that do different things, and in conjunction, they do miraculous things. And it depends truly on what you're coming to us for. What do we use acupuncture for? I have patients ranging from Bell's palsy to paralysis from a vehicular accident, fertility treatments, lower back pain, and I have a lot of athletes that come in just to make sure that they're conditioned for the new season. So acupuncture is a balancing of your yin and yang, your muscles and skeletal systems, your internal organs with your external, and so on and so forth. Now, I'm going to let you in on a secret. I am terrified of needles. I know. I do acupuncture, so how could I possibly be afraid of needles? Well, you can be, trust me. And I know a lot of peers that are. Until you go to school and they say, oh, hey, yeah, do you want to be an acupuncturist? Great. Well, the first step is you have to needle yourself and you have to let others needle you. I think that's incredibly important because how dare I stick needles in somebody if I don't know what it feels like? Now, funny story, not really funny for me, but funny for everybody else listening. I had a colleague back in master's program in California. That's where I did my schooling. And he wanted to try a brand new technique. And he named it after himself. So you should know I should have approached with caution, right? He proceeded to stick a needle into my Achilles tendon, not into the space underneath, but into, and force it through. So if you have any doubt what I know and how badly it hurts to hit the wrong thing, you're sorely mistaken, because that I was not able to walk for 6 weeks, not because he put it in, but because they had to take it out. My Achilles was completely, the needle was sticking in one side and out the other. So is it possible to do that? Oh yeah, it is. Would you ever want to? No. That is the most painful experience that I had during that schooling. Now, a lot of people are terrified of pneumothorax. So what if they puncture a lung? What if they do the wrong thing, or they hit the wrong organ, or XYZ? That is a legitimate fear. We are trained to do very light insertions. So very, very shallow. And you still get the same type of experience doing shallow insertions versus deeper insertions. But the amazing thing is, rarely has a licensed acupuncturist actually punctured a lung. Most of the cases you hear are from non-licensed or non-acupuncture licensed professionals that have a certificate in dry needling or something similar that doesn't understand how acupuncture works and administers needles. Now, I have very good networking systems here, and I have a lot of physical therapists that actually are certified in dry needling, but we discuss and we are very open about educating how it's different from acupuncture. Now, that leads me to my next question. What's the difference between acupuncture and dry needling? Well, dry needling is a term that is used by non-acupuncturists. Only acupuncture is allowed by acupuncturists, and you have to, again, go through that extensive schooling and certification process to get there. Whereas dry needling can be achieved by, I think, 100 hours of, which is pretty much a weekend course or a month course, depending on how you break it up, by chiropractors or physical therapists or MDs. Now, here's my question for you. If we have to go through, we as an acupuncturist have to go through 3 to 4 years of schooling, extensive round of boards, to be able to put needles into somebody else's body, how are you comfortable letting somebody with 100 hours put needles in you? Now, that's not to knock the people that do it. And again, like I said, I have classes here, actually, of my peers 2 times a week at my clinic, where they come to learn more about dry needling and how to administer it safely, which I think is huge. I believe that we need to share the education. We need to share our understanding so that we can provide better care for all of our clients and our patients and just people in general. With all the false information and the really, really crazy things you find on Wikipedia or Google, coming from an actual professional who does this for a living and for a passionate life, it's different. So that was my 2 cents, I guess, on dry needling versus acupuncture. Now, let's go to the next question. What does an acupuncturist do? Acupuncture, trigger puncture, or dry needling, cupping, moxibustion, e-stim acupuncture, shiatsu, tuina. Those are just a couple modalities that we are able to do in acupuncture. And again, we learn all of this extensively, and we have it administered to us and by us in school to make sure we know exactly what we are doing. Not everybody needs cupping. So unfortunately, I do have some people that saw Michael Phelps on TV with the cupping marks come in and demand cupping. I'm sorry, if you don't need it, I will flat out refuse you because it's not going to help you. A lot of chiropractors call it decompression therapy, which is a great way to put it. But again, it is so much more than that. We can't fit acupuncture and our modalities into nice little round pieces. Some are star-shaped, some are circular, some are square, some are oval, and some are just irregular. But it's up to the practitioner to make the right pieces fit for you to get better and achieve what you're looking for. Next, Chinese medicine and herbs. I do work a lot with Chinese medicine, so herbs. Little bit different than the herb teas that you see in Whole Foods or the grocery store. It's not just the chamomile or the jasmine. They're actually Chinese herbs, and they vary. We call them Chinese herbs because they're probably things that you've never really thought of or heard of before. And depending on the condition that you present to us, there are a couple different forms that I use. And there's a powder form, there's a tincture form, there is a capsule form, and then there's the most expensive liquid form. And I do mostly powder and liquid because I find them to be the most effective for me. Again, it's a preferential thing, but I find that works better for me and my clients. Now, again, like I said, I work a lot with athletes, national and collegiate athletes. So being a fourth generation acupuncturist, it allows me to have access to formulas passed down from previous generations that are not in textbooks, that are not in mainstream. And a lot of them are actually poultices or soaks or plasters that I use to promote faster healing and recovery. And that's not to say I'm the only person that does it. There are a lot of herbalists, and there's actually my mentor he's actually the chairman of the WHO, but he prefers different styles of Chinese herbs and needling than I do. But we find that plasters and poultices for topical usage are almost just as effective for certain conditions as the drinking and drinking types, really. So with Chinese medicine, a lot of people are taking pharmaceuticals, high blood pressure, diabetes. We can take herbs while you are currently taking your pharmaceuticals. There is a time interval that we need in between the time that you take your pills and that you can do the herbs. But again, this is case by case, and you need to refer to your practitioner. And a lot of times we do have great relationships with MDs, so we're able to give them a call and discuss what we're doing, and we are able to give progress reports as well so that the MD is fully aware every step of the way what we do. Now that's also case by case difference. I like to keep the other practitioners as involved with this treatment plan as I feel like they should be. The more knowledge they have of what we're doing, the better able to help the patient from any other aspects of this treatment case. Herbs are a beautiful thing. I've used certain empirical formulas as a powder form so that one of my clients who has a skin disorder as a topical. We used it as a facial wash for 10 days, and he's been completely freed from all of his external symptoms. And I mean itching, bleeding, open scars, pus all over the face and ears. And 10 days with acupuncture, he is freed from all those symptoms. So they do amazing things, and the beauty of it is there's no side effects of addiction. There is no side effects of dependency, as long as you are given the right formula for your condition. So my formulas cannot be shared with two patients or two clients that have the same conditions. So you can both come to me for a sore throat, itchy nose, pounding headaches, and I will give you two separate formulas because the constitution of your body is completely different. Now, how do we combat that? You go to Whole Foods, you see those tinctures, those allergy relief, the sinus relief. How do those work for general public? Well, you'll find that there are no side effects, or least amount of side effects, because it's generalized, but it's also not as effective as having one catered specifically to you. So in a bind, Magnolia Clear Sinus or any of the allergy medicines, the sinus pressure ones, they'll work to a certain degree, but you'll feel them not being as effective as if you were to be catered and tailored to a specific formula based on your condition, your history, and your current state. So there are goods and bads to everything that we're being offered. Lastly, I want to wrap this first session up, I guess, a little bit quickly. There are, I think the last time we did a poll, there was about 34,000 acupuncturists in the entire state of, the entire United States, getting confused. And you can't expect all of us to be the exact same. So I encourage you to keep asking questions and not to challenge. There's a difference between challenging and asking questions, because my personal style is I like to educate. I like to make sure all of my clients know what I am doing and why. I will share my treatment protocol. I will tell you exactly why I'm needling certain points on the body. And I take into account what they want to talk about and what they are feeling at that moment. There are practitioners like my parents who are also educators. There's people and practitioners like my mentor who is of very little words. I think the entire year that I was doing my internship with him, he spoke maybe 6 words per month. Everything else was by observation and by visual notes. And that is a different style. So if you like somebody to just give you a treatment, walk out, leave you, and then continue to monitor silently, there are people like that. If you want to have a personal relationship and you are of the same mind as kind of I am, the more I tell you and the more you know about what's going on with me, the better you can help me, then find that practitioner. Again, I cannot stress to you that one bad experience with one practitioner should not ruin that line of communication for you and this beautiful science. I say Eastern medicine is a beautiful, artful science, because it is truly a science at the baseline. But there is so much more art to it. There's so much more history and fluidity to this than having just symptoms and this is the treatment that you need. There's so much more to that. And there are so many of us willing to work with you and be your partner to find that next step, to take you back to being pain-free as best as we can and living your best life. So Our goal, my motto, is naturally live well. And I hope that some part of this session helps you to open your minds and truly find the right wording for the questions you may or may not have had in your daily life. And it truly asks you to question the quality of care and the quality of life that you like to have, and which partners you like to pick. Life is like the Hunger Games, right? You want to come out on top and be the best possible version of yourself. I want to make sure that you are able to make the right decisions and make the right choices and questions to find the people you want on your team to naturally live well. Thanks so much for spending all of this time with me. This was the first session of A Cup of Tea with Dr. Lee. Next week, we're going to actually talk about specific disorders. And in the bio, you can find the website, you can find a emailing address that you can send questions, comments, or concerns, and I personally answer all of them myself. So please feel free, even if you have never experienced or you have bad experiences, questions, comments, concerns are always welcome so that we can find truly a healthful journey for you. So thank you again. I'll see you guys next week.